Frank was 78, and his family had slowly come to think of him as a different person than he used to be. The man who had once been the loudest laugh at every gathering now sat quietly in the corner. He'd stopped working in his garden, the garden he'd tended for 30 years. He was shorter-tempered than he used to be, snapping at small things. He slept poorly, ate less, and had withdrawn from the card games and the morning walks that had structured his week for as long as anyone could remember. His daughter worried, privately, that this was the beginning of dementia, or depression, or just the slow fading that she'd been told to expect. What no one understood, because Frank never complained, was that he was in pain, constant pain. His knees and his lower back hurt every single day, from the moment he woke until the moment he fell asleep, and often through the night, too. He had simply decided somewhere along the way that pain was part of getting old, that complaining was weak, that nothing could be done anyway, so he said nothing, and he endured it. And the pain, untreated and relentless, quietly rewired his entire personality, his mood, his sleep, his movement, and his relationship with the people he loved. When his daughter finally connected the dots, when she stopped seeing an old man fading and started seeing a man in pain and got him properly evaluated and treated, she got her father back. Not entirely, not all at once, but meaningfully. The laugh came back, the garden came back, the man came back. I'm telling you Frank's story today because chronic pain in older adults is one of the most undertreated, most misunderstood, and most consequential conditions in all of elder care. It affects a majority of older adults, and it is routinely dismissed by families, by older adults themselves, and even by some healthcare providers as a normal, inevitable, untreatable part of aging. It is not. And today I'm going to show you what untreated chronic pain actually does to an older adult, why it stays so well hidden, why the standard approaches so often fail this population, and what your family can do to recognize it and get it properly treated. Because the single most important message of this entire video is this: pain is not an inevitable part of aging, and in the vast majority of cases, something can be done. Before we go further, if Frank's story made you think of someone you love, share this video with the people in your family who need to hear it. And if you haven't subscribed to this channel yet, do it now. Every week one publish content exactly like this, clinical, honest, and built for families navigating the care of an aging parent. Subscribe so you don't miss what's coming. Let me start with the thing that makes this whole problem so insidious. Chronic pain in older adults frequently doesn't look like pain. When we picture someone in pain, we picture grimacing, complaining, holding the affected area, asking for help. But that is acute pain, the sharp, recent, obvious kind. Chronic pain, the kind that grinds on for months and years, behaves completely differently, especially in older adults. It hides, it disguises itself as other things, and it shows up most often not as a complaint about pain, but as a change in the person. This is the single most important concept I want you to take from this video, so let me be very direct about it. In older adults, untreated chronic pain commonly presents as withdrawal from activities and social life, irritability and personality changes, sleep disturbances, loss of appetite, reduced movement and increasing physical frailty, difficulty concentrating, memory problems, and confusion that can look exactly like cognitive decline, and depressed mood, low energy, and loss of interest in life. Look at that list again. Every single one of those symptoms is something families routinely attribute to aging, to dementia, or to depression, when the actual root cause is untreated pain. Frank's family saw withdrawal, irritability, poor sleep, lost appetite, and reduced movement, and concluded he was declining. They were seeing pain the entire time. They just didn't recognize its disguise. So why does pain stay so hidden? Several reasons converge. Many older adults genuinely believe pain is a normal, unavoidable part of aging that simply must be tolerated, so they never mention it. Many come from a generation that views complaining as weakness and stoicism as virtue. Some fear that reporting pain will lead to more tests, more medications, more loss of independence, or being seen as a burden. And critically, those with any degree of cognitive impairment may genuinely lose the ability to articulate that they're in pain, or even to fully recognize it themselves, even as their behavior changes dramatically in response to it. Now let me explain what untreated chronic pain actually does, because the consequences extend through every system of an older adult's life, and they compound. The first consequence is the destruction of sleep. Pain makes it harder to fall asleep and causes repeated waking through the night. And as I've covered before on this channel, poor sleep in older adults isn't just exhausting. It accelerates cognitive decline, worsens mood, weakens the immune system, and impairs the body's ability to heal. Pain and sleep loss form a vicious cycle. Pain disrupts sleep, and sleep deprivation actually lowers the body's pain threshold, making the pain feel worse the next day. The second consequence is reduced movement, which is far more dangerous than it sounds. When something hurts, the natural response is to move less. But in older adults, reduced movement leads directly to muscle loss, weakness, stiffness, and worsening balance, which increases fall risk, accelerates frailty, and paradoxically often makes the underlying pain worse, because deconditioned muscles and stiff joints hurt more, not less. The person becomes trapped. Pain causes immobility. Immobility worsens the body, and the worsened body produces more pain. The third consequence is the profound effect on mood and mental health. Chronic pain is one of the strongest risk factors for depression in older adults. Living with constant, unrelenting discomfort is exhausting and demoralizing, and it drains the capacity for joy, engagement, and connection. The link runs both ways. Pain causes depression, and depression amplifies the experience of pain. The fourth consequence is cognitive. Chronic pain consumes attention and mental resources. It impairs concentration, memory, and clear thinking. In older adults, this pain-related cognitive impairment can closely mimic the early stages of dementia, which means people are sometimes evaluated, worried over, and even treated for cognitive decline when the real, treatable culprit is unmanaged pain. And the fifth consequence is the overarching one: a collapse in quality of life and a loss of the person's engagement with their own life, activities abandoned, relationships narrowed, the world made smaller and grayer, one painful day at a time. This is what had happened to Frank. The pain didn't just hurt him. It slowly erased him. If you're finding this valuable, and I hope you are, take 1 second right now and hit the like button. It genuinely helps this content reach other families who are watching a parent fade and don't yet realize that pain might be the reason. Like and keep watching. Now let me talk about why treating pain in older adults is genuinely more complicated, because understanding this helps you advocate intelligently rather than just demanding a quick fix. The aging body processes medications differently. Kidney and liver function decline, which means drugs stay in the system longer and at higher concentrations. Older adults are more sensitive to side effects, and most are already taking multiple medications, which creates real risks of dangerous interactions. This means the medications commonly reached for in younger people carry greater risks here. Take the most common over-the-counter pain relievers. The anti-inflammatory drugs, ibuprofen, naproxen, and similar that younger people use casually carry serious risks in older adults, including stomach bleeding, kidney damage, and cardiovascular problems. They're often not safe for regular, long-term use in this population. Opioids, at the other end, can be appropriate in specific situations but bring significant concerns about sedation, confusion, constipation, falls, and dependence, and require careful expert management. I am not telling you this to make you feel that nothing can be done. I'm telling you the opposite. I'm telling you this because the right approach to chronic pain in older adults is rarely a single pill, and families who understand that are far better positioned to get their parent real, effective, sustainable relief. Because here is the genuinely hopeful part. The most effective approach to chronic pain in older adults is multimodal, combining several strategies that work together, often allowing lower doses of any single medication and producing better results than any one approach alone. Physical therapy is frequently the most powerful intervention of all, and it is dramatically underused. A skilled physical therapist can strengthen the muscles supporting painful joints, improve flexibility and balance, and break the immobility pain cycle that traps so many older adults. For many types of chronic pain, particularly back, knee, hip, and arthritis pain, movement, properly guided, is medicine. Beyond that, there's a whole toolkit. Topical treatments, creams, gels, and patches applied directly to the painful area can provide real relief with far fewer whole-body side effects. Heat and cold therapy. Appropriate gentle exercise like walking, swimming, or Tai Chi, which is strong evidence for both pain and fall prevention. Acetaminophen, which when used correctly, is often a safer first-line option than anti-inflammatories for older adults. Treatment of the underlying condition itself, a joint injection, or in some cases a joint replacement, which can be genuinely life-changing. And addressing the mood and sleep components, because treating the depression and restoring the sleep often reduces the pain itself. The point is this. There is almost always something that can be done. The right answer is rarely just live with it, and it's rarely a single drug. It's a thoughtful combination, tailored to the individual, and that requires a proper evaluation. This is the moment in the video where I want to ask you something directly. If this video has helped you see a parent's withdrawal, irritability, or fading in a completely new light, if you're starting to wonder whether pain has been the hidden cause all along, share this video with the family members who share their care. This is a perspective shift that can genuinely change the course of someone's final years. and it needs to reach the whole family. Share it. Leave a comment below telling me what you're navigating. And subscribe if you haven't yet. It's the best way to make sure this kind of guidance keeps reaching you. Here's what your family can do starting this week. Today, shift your own lens. Look at the changes you've attributed to aging, dementia, or depression, the withdrawal, the irritability, the poor sleep, the lost appetite, the reduced movement, and ask yourself honestly, could pain be underneath any of this? Simply holding that possibility is the first and most important step. This week, ask directly, but gently and specifically. Older adults often won't volunteer pain in vague questions like, "Are you in pain?" Frequently get a reflexive, "I'm fine." Ask better questions. Does it hurt when you stand up? Which movements have you been avoiding lately? On a scale of 1 to 10, what's your knee right now? And what was it this morning? Specific, concrete questions surface. What general ones miss? And watch the body, not just the words. Wincing, guarding a limb, difficulty rising from a chair, slowed movement. Also this week, make a list of where it hurts, when, how severely, and what makes it better or worse. This pain record is enormously valuable for a productive medical appointment, especially if your parent struggles to articulate or tends to minimize. This month, get a proper pain evaluation with a doctor and frame it as exactly that, a focused conversation about pain, not a general checkup where it gets lost. Bring your record. Ask specifically about a referral to physical therapy. Ask whether any current medications could be contributing, and ask about the full multimodal toolkit, not just a prescription. If the pain is complex or severe, ask whether a referral to a pain specialist or a geriatric medicine specialist is appropriate. Ongoing. Treat pain as the vital sign it is. Keep asking. Keep watching. Encourage safe movement rather than total rest, because immobility almost always makes things worse over time. And hold on to the truth at the center of all of this, that relief is usually possible, and that pursuing it can give your parent back far more than comfort. It can give them back themselves. Here's what I want you to carry with you from today. For years, Frank suffered in silence because he believed pain was just what aging felt like, and that nothing could be done. He was wrong on both counts, but he had no way to know that, and no one around him recognized what was really happening. The tragedy wasn't the pain itself. The tragedy was that it was treatable the entire time, and it stole years from him, while everyone, including the people who loved him most, mistook it for something else. Your parent may be carrying something similar in silence right now. The stoic generation, the belief that complaining is weakness, the assumption that pain is simply the price of growing old. These keep millions of older adults suffering needlessly when relief is genuinely within reach. You can be the one who sees through the disguise, who looks at the withdrawal and the irritability and the fading and asks the question no one else thought to ask, who refuses to accept it's just old age as the final answer. That shift in perspective from "my parent is declining" to "my parent might be in pain" is one of the most powerful gifts a family member can give. It gave Frank's daughter her father back. It might do the same for you. If this video gave you something real, something you're going to act on, or share with someone, or carry into a conversation with your own family, please take a moment to like it. Share it with the people who share your parents' care, because this perspective is one that everyone in the family needs to hold. And leave a comment below telling me what you're navigating, what's worked for you, or what you wish you'd recognized sooner. I read every single one. And if you haven't subscribed to this channel yet, please subscribe. This is where I publish honest, clinical, practical guidance for families trying to do right by the people they love every single week. Thank you for being here and for caring enough to watch all the way to the end. That attention is exactly what makes the difference. I'll see you soon.